Welcome to Unity Health. I'm Rhonda Davis, nurse educator. I want to share with you today some important information related to your upcoming clinical assignments at one of the many Unity Health locations. We are very happy to have you here, and we want you to have meaningful experiences as you learn in our facility. I'm going to cover today a variety of topics in an effort to provide you an overview of your role as a student at Unity Health. I want you to please feel free to ask your instructor questions if you have any questions at all about the information that I share or need any other information as you proceed to your clinical day. Let's start with dress code. I want to make sure that you're aware that you're responsible to follow Unity Health dress code as well as your own school's dress code. In the event that the two dress codes don't match, you'd want to make sure that you follow the stricter policy. An excellent example of that is how at Unity Health we're allowed to wear colored tennis shoes as part of our wardrobe. Your facility may require, however, that you wear solid white tennis shoes. And in that case, you would want to follow the stricter dress code policy. Program requirements differ as well, so you'd want to make sure in things such as cell phone use that you again are mindful of both Unity Health and your program-specific policy. Another example is in regard to cell phone use. You would want to make sure that you are using your cell phone in the proper way. Our policy is that you could use that in the nurse's lounge, in the cafeteria, or in the waiting areas of the hospital. However, if your program requires that you don't use your phone at all during class time or clinical time, you would want to follow their stricter policy. Just a few words about student flow. We have so many students that come to Unity Health, and we are blessed by that and glad to have them. But there is a lot of planning that goes into making sure that the assignments and the flow and the volume works well. So you're going to encounter in your stay here a great number of students from multiple disciplines, such as pharmacy students, medical residents, physician assistants, as well as ancillary departments such as radiology and cardiopulmonary. So we want to make sure that the flow is right for our staff. And as we plan that, it's very important that you stay in the areas where you've been assigned and not move to a different area without first consulting the education department at Unity Health. Also want to make sure that you're fully aware of how important communication is. It's very, very important in healthcare to make sure that you talk to your team. Your team needs to know where you are in your day, what's going on with your patient, what's going on with the tasks at hand, with the skills that are to be performed. Your instructor needs to know that as well. But we also want you to talk to us. We want you to talk to your nurse, to your CSA, and to us in the education department if you have questions while you're here. You want to share information at the beginning of your rotation and at the beginning of your shift regarding your role, your length of the clinical day, whether you're there for a 3 to 11 slot perhaps, or 7 to 3, and what care you'll be providing. Also the level of practice with respect to skills. We have a number of different nursing programs and other programs that may be practicing at different levels. For instance, a practical nurse will have a different level of skill that they are able to provide versus a RN an RN student in perhaps an associate degree program versus a bachelor's program. Want our staff to be connected with you to understand where you are so they can help you as effectively as they can. Also want to make sure that you understand that each nurse at Unity Health should only have 2 students at a time. And sometimes that can be a little bit of a challenge. We want to make sure, though, that the nurses have adequate ability to be a resource for you, and also that the flow of care is not interrupted throughout the day. So make sure that that is always the case. 2 students per nurse, and no more than that. An instance where that can be a challenge, I want you to be aware of this so that you can plan adequately with your instructors. Perhaps you came the day before to pick up patients, and maybe you selected a patient in room 1, and a friend of yours selected a patient in room 5, and maybe someone from a different program selected a patient in room 6. So that sounds like it'll work because this nurse that day may have the patients in rooms 1 through 5. If someone is discharged, however, in room 2, the nurse on the following day may be assigned rooms 1 through 6, in order to accommodate the 5 patients, and then that would leave them with 3 students to 1 nurse. So there would have to be an adjustment made. And you would want to talk with your instructor about that so that they can help you get reassigned in that same area to a new patient and make sure that that takes place. Let us know if you have any problems related to that. We'll be glad to help. Unity Health nurses are always primarily responsible for the patient, and we do share with our staff that we want you to participate as fully as possible in care, but that they are at their discretion to pull a skill back into their own realm if they feel like that's in the best interest of the patient, either for the patient's anxiety level or family request or anything like that. So just be aware that sometimes if the nurse says, you know, I'm gonna make this IV attempt, please don't take that personally. That's just them taking responsibility for their patients, as they should, as the primary nurse. A few words about professionalism. Very important, again, to make sure that you communicate effectively with the staff and with the patients. You need to anticipate their care needs and provide prompt patient assistance. That's something that's frequently reported in patient satisfaction surveys. And just imagine if it was your mother, your grandmother, do you want them to have to wait to use the restroom or to get the care that they need? No, you don't. You want them to have the help that they need when they need it. So another thing is to make sure that we're quiet in patient areas. Sometimes it's easy when we're with a friend or meeting the staff and talking about our day to become a little bit too loud. The patients are sick. They're trying to rest. It's very important that we keep a calm and quiet atmosphere for them in the patient care areas. As students, you're not allowed to administer narcotics, pain medicines, and so when you find that your patient is in pain or they report that to you, it's very important for you to report that to the nurse as promptly as possible so that that can be taken care of and that need met in a prompt way. Also, make sure that the patient information that you gather is de-identified prior to you leaving the facility with it. For instance, at the end of the day, your instructor may ask that you provide patient progress notes, and that's perfectly fine with us, provided it is fully de-identified of patient identifiers before you take it out of here. So have your scissors handy and you know what to do. I would encourage you to look on all edges of the form because sometimes the patient information can be at the bottom of the page. Want to make sure if you come in advance to get a patient assignment that you wear business casual, a white lab coat, and your name tag. A couple things about that. It's very important that we know who you are, that we know why you're in our facility and why you're accessing patient information. If you're clearly identified, we can tell exactly why you're there and work effectively to help you. Again, the business casual dress code you'll see in the dress code policy, but primarily, don't wear blue jeans. Wear slacks, wear something appropriate, be modest, and wear your lab coat and your proper identifier. Make sure we talk about smoking. Here's one of those things that can get a little sticky. We're a non-smoking campus. We're not supposed to have smoking on the campus, but we do occasionally have a patient who will insist on going outside to smoke. And when that happens, it's important for you to involve the primary nurse right away so that they can help facilitate conversation with that patient and that family regarding that patient's care. We're going to share information separately about medication administration, but a couple things I wanted to say about that. Please be prepared to be safe in medication administration. It is very important that every patient gets the right medicine every time. That's a can't-miss situation. And I want you to understand that medication administration in our facility is a privilege that we grant to you, and we expect you to use that wisely. Use it as a learning experience. We want you to have that experience, but it is one that you need to use wisely and use cautiously, and be mindful that it is possible to hurt someone, and you wouldn't ever want to do that, I know. So, another thing we need to talk about is policy information. Couple things that we need to highlight here. And you'll have the policies in front of you as I talk, so I encourage you to always keep that. Make sure that you bring it to clinical with you if you need it as a point of reference or if you want to review that the day before you come. There's a few things we want you to know. We want you to attempt that IV placement, but we don't want you to do that more than one time. That's because we're very concerned about the comfort and satisfaction of our patients. And there's a time to learn, and there's a time to involve a more experienced provider. So attempt one time, and we hope you get it. Have confidence that you will. But if you don't, be sure and get one of the Unity Health nurses to help you. At no time should a nursing student take any verbal orders from a physician. That's outside your scope. That needs to be one of the licensed nurses with Unity Health. So if a physician sees you in scrubs and thinks, I'm just going to give them some orders right now, you just need to identify yourself as a student and encourage them to find one of the staff members. You can help them do that. You just can't take the orders. Another thing that you can't do is take critical lab results on the phone from lab. Very important that it be one of our staff who gets that message, because we may need to follow up in a very rapid, specific way in order to ensure that patient's safety. So we wouldn't want that responsibility to fall on a student. So it's very important that if the lab calls, perhaps you answer the phone to help out, and they identify that they have a critical lab result to share. Be sure that you get that to one of the licensed nurses on the floor where you are. You're not allowed to, as a student, witness any permits for any procedures. So if a patient's going to have surgery, we welcome you to follow the primary nurse to watch how that process happens, but we're not going to allow you to be the witness for that procedure. With respect to CVL care, central line care, qualified RN students are allowed to participate and provide central venous line care as long as there's a Unity Health RN present with them at the bedside. So you may not do that just you and your instructor alone. You have to have a Unity Health nurse with you. Our nurses understand that, and they know that that's the only way you're going to get to participate. They're glad to help you. Try to coordinate that with them in planning the course of care for the day when you're communicating with them in the morning. With respect to isolation patients, we do encourage you to learn that process, and we want you to understand how it works, how important it is. There are a couple of circumstances, however, where you're not going to be allowed to take care of a patient in isolation. One of those is if the patient is in airborne isolation. The rationale for that is that you've not been provided with the adequate training or equipment, respect to fit testing, that you need in order to do that safely. So we do not want you to take care of a patient who's in airborne isolation. Additionally, we don't want you to take care of a patient with VRE. You may be familiar with that organism. It's a very significant infection, one that we're highly motivated to try to contain, and so we want to make sure that that falls in the hands of Unity Health staff as well. Also, one final thought with respect to blood administration and our policy. We want to make sure that you understand you're, as an RN student and even as an LPN student, allowed to witness our RNs initiating a blood transfusion, but you're not allowed to be the person performing that skill. That is because it is a very sensitive, it's a high-risk procedure. It doesn't happen very often that goes wrong, but again, we would certainly want to be the ones bearing the responsibility for that and not have that significant of an issue fall into the realm of a student. So just make sure that you're more than welcome to follow that nurse as they do that skill. With respect to vital signs, you'll find that as you go to the various departments that the scheduled and routine vital signs times may change per that area. You've got a handout in your packet that does describe the various practices of the floors that you'll be on, and I really encourage you to take a look at that before you arrive for clinicals on the day that you're scheduled to come. Make sure if you do find that you've discovered an abnormal vital sign that you do report that promptly to the nurse, particularly in light of patients who may be septic. There are things that are time sensitive that have to happen for them, so we do want you to report that promptly to the staff. One other thing I would share with you just as an insight, be aware of trends in vital signs. For instance, how would you be able to determine if a post-operative hemoglobin of 10 was a good or a bad thing? How would you? Think about that for a second. Unless you know the prior lab results, you wouldn't. If the prior lab result had been 14, your patient may be in trouble. They've dropped quite a bit. If the prior lab result was 10 as well, then they haven't changed at all, and there's nothing to worry about. So we do want you to be aware of the vital signs trend and not only the number that you're looking at the moment. With respect to telemetry, we do want you to understand that that's a very significant monitoring system. It's very important that that monitoring stay consistent and that it's noted at all times. We have monitor techs who are watching that continuously. So it's very important that that monitoring does not come off of the patient unless there is a physician's order to do so. For instance, if the patient is requesting to get up and take a shower, there must be a physician's order that says patient may shower. If that doesn't exist, an order for that must be obtained before you take telemetry off to get in the shower. That may seem insignificant, but think about the implications of a patient who did not have that order. If you remove the telemetry and you put them in the shower and they have a cardiovascular event, not a good situation. So you want to make sure that you are covered there at all times. Make sure that if you're communicating with our monitor techs that you share the patient's room number, the monitor that they are on, and their current location. If your patient's going to leave the floor for any reason and they're on telemetry monitoring, we always have to notify the techs so that they will know the physical location of the patients at all times. If there is a problem, they have to be able to notify staff in that area where the patient's located right away. So it's important to always communicate that. Once the patient returns to their patient room from whatever area they were in, it's important to let telemetry know that as well and communicate with them. Electrodes with telemetry must be changed every 24 hours. So if you're helping a patient with shower, you want to make sure that you do take care of that at the time that that's taking place. If they don't have an order to shower and you're just doing their AM care in a partial bath or bedside assistance type role, you still want to make sure that you change the electrodes so that the gel in the pad is actually moist and does control the signal really well. Fall risk patients. I hope that you've been around healthcare long enough now to realize how significant the risk of fall is in hospitalized patients, and even in patients in outpatient settings where you may be dealing with the frail elderly or people with chronic health conditions and maybe extenuating circumstances. Perhaps they do pretty well most of the time, but today they're quite ill and don't feel well, and they're going to be at higher risk of fall. And once we hook them up to some devices, IV tubing, telemetry monitors, that risk increases even more. So it's important for you to note what level fall risk your patient is. We define fall risk in a level 1, 2, or 3 category. 1 is low risk, 2 is moderate, and 3 is high. Patients who are at moderate and high risk are never to be left unattended when they are up and out of bed. So if you assist a level 2 fall risk patient to the bathroom or to the bedside commode or even to the chair, they're not to be left unattended while they are up like that because they're at higher risk for fall. Want to make sure too that they use non-skid footwear, that we keep the beds low and locked. And an important thing that you can do that sometimes gets overlooked is keeping the pathway and the environmental surfaces clear. If we have tubing, if we have furniture, if we have trash cans, bedside tables, things like that that clutter up the space that the patient's trying to navigate in physically, makes it very hard for them to find their way, and they are at higher risk of fall. So we'd want to be very conscious of that as we go along. A couple other things and we'll be done. We'll talk about trash and linen really quickly. Want to make sure, we just talked about the trash can, making sure that we keep that taken care of so that it's not an encumbrance in the patient's room. But also want to talk to you about contaminated trash. And we want to make sure that you're clear on what we mean by that. Contaminated trash refers to any waste that may be contaminated with blood or body fluids. If it's contaminated with blood or body fluids, it should be treated as contaminated waste and placed in a red bag. We do not need to red bag things that are soiled with urine or feces. Those are considered regular, if you will, waste and can be disposed of in the regular way, except if there is visible blood in either. So if you did have a patient with gross hematuria, or if you did have a patient with a GI bleed, that would change that to contaminated waste. So I just want to make sure that everyone's clear about that. Regular linen change, we would bag that in a blue bag and make sure that we launder it the same way. The great thing about this is you don't have to sort contaminated linen from regular linen because all of our linen is laundered to the same standard. So we treat all of our linen as if it's contaminated and launder it all in that way. And while that sounds great, I would highlight for you that that's not an inexpensive process, and we don't want to be wasteful of the linen that we have. It's quite a costly thing to launder it unnecessarily. So please be mindful of how much linen you take into the patient's room. Don't take more than you actually are going to need, and make sure that you're mindful of the cost associated with that as you provide your patient's care. When you're taking care of your patient at mealtime, make sure that we have them set up appropriately for the meal, that their items that they require are close at hand. If there's any risk of swallowing being an issue, or if you're concerned about patient choking, make sure that you stay and observe the patient as they try to eat their meal. Additionally, certain patients may have a very difficult time feeding themselves adequately. That may be because of a physical or a cognitive deficit that they have. Make sure that you assist them in eating their meals appropriately. Following that, we would want to make sure that we get accurate I&O, making sure that we record how much the patient eats and drinks and how much is then resulting in output so that we can track their hydration and nutrition status adequately. Also, I would remind you, make sure that you are directly familiar with the diet that the patient is on, making sure that you're aware if they're supposed to be NPO for a test, if there's some sort of a swallowing concern, are they diabetic? Various things can come into play, so I just want to make sure that you always check that and are aware of what diet they have been asked to be provided to them. I think that's all that I need to share with you today. I'm really, really glad that you've taken the time to get to know us a little better at Unity Health. We really want you to have a great experience. We hear great things about students all the time. I would share with you this, though. Be aware that as you're here as a student, you are actually building your professional credibility right now. You're not a nurse yet. You're not practicing in your field of specialty yet. But our staff is watching. They see how you perform. They notice if you're a high performer, if you have high integrity, if you're great with patients. They also notice if you're not. So I would make sure that you're really aware of your own professional demeanor and your own behavior in the clinical environment as you go through clinicals. You've probably heard that from your teachers before. Sometimes it helps to hear that from a third party. So we just want to make sure that both you and Unity Health have a great clinical day. Thank you for your time.